Hey guys, welcome to the TRT and Hormone Optimization YouTube channel. I'm Danny Bossa, joined again my special guest, world record powerlifter, author of the Vertical Diet ebook coming out, actually the hard copy coming out, Barnes & Noble and Amazon August 10th. Welcome, Stan Efferding.
Thanks for having me back, Danny. In our first video, I promised to be brief, and I think I ran half an hour. I tend to be a little long-winded. So we're going to talk about blood pressure today. It's probably one of the most important topics. I deal with a lot of large athletes or a lot of aging dad bods that have started to add some numbers to their systolic blood pressure over the years. And it's one of the most important things that they can mitigate. So I'm going to try and give you step-by-step a checklist I give them. I believe in action items, easy to follow, step-by-step checklist. And I want to put it in an order that I think is from most important to least important, so people can really work on the big rocks.
Consider subscribing, hit that notification bell, and you'll be on your way.
So here we are, high blood pressure, quick fix kit. I think everybody knows that high blood pressure can cause heart disease, stroke, kidney disease. There's a lot of conditions you can't control: age, family history, race. Even sex. Men under 55 tend to have more elevated blood pressure than women, and women over 55 tend to have more elevated blood pressure than men. So, but there are a lot of lifestyle factors, as we know, that can help with blood pressure. The obvious ones are obviously smoking and excess alcohol consumption. Those are no-brainer. If if the audience is on our site and they're still smoking and drinking too much, then there's probably not much we can do to help them. These are action items that you need to do yourself. There's no quick fix to what they call essential hypertension. Matter of fact, essential hypertension is defined as no known cause, and because it's multivariate, and doctors like to pinpoint things down to one cause so that they can resolve that in many cases with a medication. That can't necessarily be done with hypertension. It's multifactorial, so you have to attack it from a lot of different angles. Probably one of the biggest things you could do is lose weight, and everybody knows that. You get yourself about a pound of systolic blood pressure decrease, or 1 millimeter of systolic blood pressure decrease for pound of body weight loss. So you lose 20 pounds, your blood pressure can go from 160 to 140. And it doesn't, you don't have to have
losing like fat pounds or body weight pounds, regardless if it's fat or muscle.
Obviously we want to lose fat pounds. Yeah. Having said that, people think that it's a huge undertaking, but if you're 300 pounds and you lose 20 pounds, your blood pressure is going to go down significantly. You're not going to have a six-pack. And maybe not need to, but just that initial weight loss. We look for about a 7% loss, and when the reasons will become obvious as we progress here. But initially, that's what we kind of shoot for. So a 300-pound person losing 20 pounds would get a very significant decrease in blood pressure. Number 2 on my list is going to be sleep apnea. I can't tell you how many times that people go to their doctor with high blood pressure, and they end up getting blood pressure medication, and we're never given a stop bang questionnaire to find out if they've got apnea. That can bring blood pressure down, systolic blood pressure, by up to 20 points again. It's a huge number. So now we just did 40 points. You lose 20 pounds and get on a CPAP, and you got 40 points on your systolic blood pressure. Take somebody from a high risk 170 down to 130 with those 2 big rocks. And so if you snore and wake up tired, it's very likely that you have some degree of sleep apnea. It's generally based on neck girth crowding the airway. So even powerlifters, Jordan Fagenbaum from Barbell Medicine is only 198 pounds, but he's a squatter. He's thick. He's muscular. He's got a big neck. He wears a CPAP, and he's lean. He's got a six-pack. He can't be more than 10, 12% body fat at the most. So understand that it's really the symptoms that matter, not necessarily the BMI, although that's a huge contributor. Next on the list, I have to say this about CPAPs. Some people, it can become a kind of a pain, particularly internationally. I know up in Canada, and of course, when my clients reach out to me from European countries and from Australia, it's hard to get in, to get diagnosed, And even then, if you're not severe, then they'll ask you to lose weight instead of prescribing you a CPAP because it can be expensive. So I recommend a lot of my clients to get a CPAP, get a used CPAP, clean it up. We do that on Craigslist here in the States. We can get a, like a Dream Station, because they're auto regulated. They actually interpret your breathing and give you the air that you need. You set a range. They're very, very effective now. Matter of fact, when I went in for a sleep study more recently, I like to do these kind of things periodically just to see the quality of my interventions, because I've used the CPAP since the mid 90s. Ever since I got north of 230, 240 pounds, I've had some degree of apnea, worse as you get heavier, obviously. And they connected me to a Dream Station, and in the morning read the reading on the Dream Station and advised me that's where I should set it at. So it's not like the $1,500 worth test that I took with all of the wires and stuff gave me my reading. They gave me the reading off the machine.
Okay.
Because it's auto regulates. So very important. Get a CPAP if you have apnea. Next on the list, I'll put on low thyroid. People aren't very familiar with this, but there was a study done in the Journal of Hypertension that came out, and it compared two groups of people, one normal thyroid and one hypothyroid, low thyroid. They had an 18-point difference in their average systolic blood pressure throughout the day. The low thyroid people had an 18-point higher blood pressure. Having said that, there were some confounding factors. They had a higher BMI, and they had their triglycerides were also elevated. So there were some other lifestyle factors associated with that. But we know those things affect thyroid. We know that lack of sleep and high BMI affect thyroid function. So it's all kind of tied together as to what's causal. I don't always recommend medications to resolve these problems. You can improve your thyroid function and improve your sleep apnea issues and improve your testosterone by losing some body fat and improving your sleep and moving around more regularly. So we usually implement lifestyle factors for at least 30 days to see if we can get some response, and then look at the blood test to see if those numbers didn't improve before we move along with potentially intervening with some sort of medical prescriptions or something like that. Next one on the list will take us to hyperinsulinemia. This is a big one. As you know, if you have high blood sugars and high insulin levels as a result, that's going to have a dramatic effect on your blood pressure. It'll cause your kidneys to retain sodium. You'll get some extracellular water, and that, of course, is going to increase blood pressure. So if you've got hyperinsulinemia, if you have insulin resistance and high blood sugar, then you need to remedy that. And we're going to discuss step by step in a subsequent video how to tackle that. I do like, and we'll talk in that video, I think, also about testing. A lot of people will get a fasted glucose or an HA1C, and if those are in the normal range, they'll think they're fine, and they don't understand those are lagging indicators. And you have to get tested for the leading indicators. Your fasted glucose and your HA1C can stay in the normal range for a decade or two while you still have hyperinsulinemia, while you have blood sugars and insulin levels that are spiking much higher than they should. And the area under the curve for insulin elevation is higher than is healthy. And so the way to test for that is using leading indicators. Fasted insulin or a triglyceride number is very helpful with that. Or ultimately an oral glucose tolerance test with a 30, 60, 90, and 120-minute test for both glucose and insulin. We'll tell you how your postprandial response to feeding affects your blood sugar elevation, and right behind it, your insulin, both in terms of the peak and the duration. And if you have some insulin resistance, you're going to have some elevated blood pressure as a result. So let's move on to the next one is, and obviously the way to remedy that is to lower your blood sugars. And we'll talk about that in a subsequent video. Next one, we're back to 10-minute walks. I talked about this a little bit in the previous video on ways to help remedy blood pressure, because that brings down blood sugars. Obviously, cardiovascular fitness improves your blood pressure. Your blood vessels, your endothelium will release nitric oxide as a result of exercise, which of course creates vasodilation and decreases your blood pressure. So, and frequency is more important than quantity. I have a whole video on 10-minute walks, or 10 ways 10-minute walks will change your life. And what we found is, what the research suggests, is that people who have a desk job and they sit around for 8 hours a day and then go to the gym and work out 30 minutes at night or do cardio, they don't get an all-cause mortality benefit from that, as opposed to people who get up and move frequently throughout the day. It seems that sitting for an extended period of time isn't undone by that evening cardio session. Okay. And you're much better off moving around a few minutes out of every hour or periodically throughout the day, ideally after each meal, because it helps improves digestion and manages blood sugar. So that's key to all of my clients. I have them implement these 10-minute walks after meals, mainly because they're sustainable. They're simple, sensible, and sustainable. It becomes part of a lifestyle. If I prescribe a 30-minute, 40-minute cardio session at the gym, the likelihood of them doing that for any extended period of time is very minimal, right, if not impossible. It's nauseatingly boring. It's relatively ineffective for weight loss anyhow, as we know that cardio is just not the most optimum way to lose weight. But it's good for health. And ideally, the 3 10-minute walks would be even better. That kind of gets us into food. Obviously, for high blood pressure, we're going to want to try and minimize salt intake for people who are hypertensive, who are sodium sensitive, I should say. And that's about 30% of the population who, when they eat salt, their blood pressure will elevate. If you have high blood pressure, you should limit your sodium. If you don't have high blood pressure and you're not salt sensitive, then there isn't much evidence that reducing sodium to 2.5 grams a day is going to provide you any health benefit. And this is a Cochrane research study. This isn't me saying this. So it's an effective method for hypertensives, but salt itself does not cause cardiovascular disease. Salt with elevated blood pressure, the salt's impact on blood pressure, is what causes cardiovascular disease. And we have to be cautious at this point to say that there are some people that are reverse salt sensitive, reverse hypertensive, where low sodium actually increases their blood pressure. And I've seen this many times with clients over the years who will get blood pressure medication and be told to go on a low salt diet when they were actually reverse salt sensitive. And you just have to experiment to find out if in fact low sodium adversely affects your blood pressure. Mm. So that's probably only 5, maybe to 15%, depending on which study of the population. So it's a much less likely, but reducing sodium helps. Now, the DASH studies that reduce sodium are done on hypertensive individuals, and they compare their diet to the standard American diet, which, as we know, everything works better than the standard American diet. One of the big things that they do is they include an increase in fruits and vegetables, higher potassium, higher calcium, they increase dairy, higher magnesium, higher vitamin D3. So those are the big 4. Magnesium increases vitamin D absorption. Vitamin D absorption increases calcium absorption. And potassium really helps with balancing the intra and extracellular water between sodium and potassium. So get all of those in your diet. Eat some yogurt. I try and get 4,700 milligrams of potassium a day. Potatoes have twice as much potassium as bananas. Fruit. I like fruit, particularly because it has some fiber in it. It's a lot of water. It's very satiating, so it could be part of a good, healthy diet. Is also high in potassium. So also meats that you eat. Bison, top sirloin steak has 100 milligrams of potassium for every ounce. So salmon's the same thing. So all of those things, I tend to eat a potato every day, some oranges, some spinach, some bison, obviously, some yogurt, and I get my 4,700 milligrams of potassium daily. So that's a very effective way of managing salt's impact on blood pressure. Okay. After that, caffeine can have an adverse effect on blood pressure for some people, stimulates the sympathetic nervous system. Some things that help is, say, deep breathing, post-workout and before bed. Just 5 minutes of really deep, relaxed breathing. Some people may also need to do this before going to the doctor and getting a blood pressure test, because as you know, there's white coat hypertension, where people tend to have elevated blood pressure because they're at the doctor's office. And also if the doctor's using too small of a cuff. If you've got some giant 20-inch guns, you better get a bigger cuff or you're going to have a higher blood pressure. So make sure that I try and stuff my arm at Walgreens into that little blood pressure measuring device. I might as well check my forearm on that. So be cautious about, the device that you're using to test. And that kind of takes us through, I think, all of the big rocks for blood pressure. We can throw in, a recommendation that I saw described so well on your show for low dose Tadalafil. If you want to do an intervention that has very few side effects and has additional benefits in terms of endothelial function, decreased exposure to BPH, benign prostatic hyperplasia, and increases nitric oxide, vasodilation, decrease of blood pressure, is 5 milligrams of Tadalafil a day, which was formerly Cialis. You've covered that on your show. I've sent that video to lots of people. It's very helpful, very few side effects. I put that at the very bottom of the list because I really want people to endeavor to use lifestyle interventions first before they seek medication, and work closely with your doctor if you are on medication, because as you progress through these lifestyle interventions and your blood pressure starts to decrease, you may have to decrease and eventually eliminate your medication, or your blood pressure will be too low.
Yeah. Most of the guys that will watch videos like this that has like a step-by-step, they wait to the point, okay, what's the pill I need to take that'll help? Is that I can just take and I'm good. I'll do that one.
Yeah.
If it was a matter of taking a pill, we would all look like this guy. Okay.
Indeed. It's frustrating. But thank you for the opportunity. We gotta jump onto that high blood sugar quick fix kit in our next video.
Yes, sir. Okay. Talked a bit. But if people want to reach out to you or want to know more about you, who you are, social media, if you want to share, who are.
Everything's at Stan Efferding. My website is stanefferding.com. My Instagram is at Stan Efferding. My YouTube, where I talked about all the videos that I've recorded, the free information, is also Stan Efferding. And you can find my ebook, The Vertical Diet 3.0, at stanefferding.com. And you can find my meal prep company, The Vertical Diet, at stanefferding.com, and order prep meals nationwide with free delivery anytime you want.